If you've been struggling with back pain for any amount of time, you might have heard the advice of why don't you just strengthen your core? Well, the problem with that is that nobody knows what the core is, what it does, or how to activate it. So today, we're going to dive into what the core is, how to control it, and how it can change your life for the better to resolve back pain naturally once and for all. Hey, I'm Dr. Nick. I'm a functional movement therapist and a back pain specialist, and I'm here to help you get out of pain from the comfort of your own home. So if you've been struggling with back pain, sciatica, disc herniation, SI joint dysfunction, or just want a back pain-free life, go ahead and hit that subscribe button so we can fill your inbox up with free content so you can live better, happier, healthier, and longer. Now, here's the problem. If you go to a neurologist or you go to an orthopedic surgeon, you're going to sit on an exam table and they're going to say, squeeze my fingers, go ahead and kick up against my hand, pull back against my hand, and you might get lucky if they ask you to raise a knee. Now, they're doing a cursory assessment where they push against you or assess how hard you squeeze and giving you a rating 1 or 0 out of 5. Very, very general and obviously not very functional because you're sitting the whole time. And what do you want to do with life? Not sit, move. And that is why we have to test functionally. We have to test through control. And I want to give you the exact musculoskeletal test that you need to do and you can do from the comfort of your own home to assess how you're doing in order to progress your training and treatment. The beautiful thing about the tests is that they move right into the treatment. They are the exact same thing. So if you're looking for some new exercises to help with your back pain and help with your core strength, here you go. And you might want to go ahead and save this video if that is going to be helpful and you find value from this content. So first, what is the core? It is the diaphragm, which controls our breathing in our lungs. It is the pelvic floor, which is the bottom that holds up our bowel and bladder. These two time together as you breathe in throughout the day, every breath of your life. And coming around the abdomen is the transverse abdominis. And this is one of your most, if not the most important core stabilizer that you have because it is right across the abdomen. And it comes all the way around to both sides of the spine, supporting the spine on either side. So you create kind of like a cylinder here, and it creates that constant or in optimal environment, creates a consistent pressure and tension. So you're not increasing your pressure like if you were holding your breath and really lifting something very heavy or pushing against something. You want to be able to control that pressure. And that at the essence is what will help to stabilize your spine, especially when you're doing things like mopping, sweeping, lifting a case of water or dog food, or your kid or grandkid. These are the muscles that you want to be able to work together. Those three: diaphragm, pelvic floor, transverse abdominis. But if we move out to a more macro level, we're going to move with our arms, legs together in order to perform these functional lifts, what are called compound movements. So as we get away from this deepest level, what we want to do is look to strengthen what we call the triangles of stability. And those are your shoulder blade muscles, your deep transverse abdominis, like we just talked about, your glutes, and your thighs, your quadriceps. Using all of these muscles together through your functional lifts. So if you think about going down to pick up a kid, I need to be able to hip hinge through my hips, stabilize through my spine, bring them close to me through my shoulder blades, and drive back up through my thighs, right? Those four muscle groups are what we train initially. Now, it's very important that before we go to strengthening a muscle, we need to be able to control that muscle. So let's jump into how to do that. So the way that we're going to control our transverse abdominis is as we're laying down on our back, you're going to feel that you have a natural curve in your lower spine. This is good. You're supposed to have this. The transverse abdominis comes across the abdomen and is a horizontal muscle. So you shouldn't feel a vertical contraction. Lots of people, when we do sit-ups, that's going to create a contraction in our rectus abdominis. Looks nice, but we don't care about him yet. What we want to do is draw that belly button in and wide. Okay, I call this picture tummy. I want to draw that belly button in, and I'm going to find my hip bones and lightly press out on that on the outside of my fingers. This is going to also get your obliques to activate. We're going to maintain this control. And then we're going to work on breathing. And I know this is a funny topic, but remember that diaphragm controls the lungs and the breath. So if you can maintain this contraction, drawn in and wide, lightly pressing out on the lateral aspects of the abdomen, finding that hip bone right there, up and in about 2 inches or so up and away, and pressing out and feeling that horizontal contraction and stability. Notice my pelvis, my lower back didn't change here. And as I breathe in, I'm also allowing the pelvic floor to fall. So remember, I said diaphragm and pelvic floor are timed initially. Many people have not heard of this fact that the diaphragm and the pelvic floor time or have any idea where it is. So it's okay. We're just going to work through that step by step. Give yourself time, a few repetitions to have a few breaths laying down with your knees bent or legs up and elevated, and you will get it. So as we find that pelvic floor, most people have a little bit of tone, a little bit of tension in the legs. We want to relax that tension. We want to relax the glutes, and we want to allow that pelvic floor to fall away from us. Imagine it's a hammock. As you breathe in, that pelvic floor lengthens. For me, I had to think almost about pushing it away, and you're going to feel this in between the genitals. So allow that to fall, relax. Think about that hammock lengthening as you maintain control here through your transverse abdominis. And that is going to be the center of everything we do, having that breath, having that core stabilization and core control, and being able to move forward from there. Next is the glutes. Now you've got two big glute muscles that we're going to test here. One is the glute maximus, the other is the glute medius. And we want to have control of those muscles, and then we want them to beat gravity. So here's how you do it. For the glute medius, it is right here on the back side of your hip. So if you take that hip bone, just go back a couple inches. It's going to be right on the side. I call this the moneymaker because it's right where your wallet would be. As you lay down, we're going to take that pelvis and we're going to roll you forward just a bit. Try to keep your legs straight, and then we're going to lift up and back, keeping the foot parallel to the ground, okay? And if you hold that, can you feel thigh, glute, or lower back working? What works? And can you keep that thigh straight? Do you have the range of motion of your hip to make this successful? Most people will notice that the thigh works quite a bit, maybe that the pelvis shifts a bit, that they feel it in their lower back. And that is an unsuccessful test. So we want to make sure that we can activate that glute medius in order to move forward, in order to do that maneuver. As you are able to progress, then you're going to work towards a higher level of sets and repetitions. I suggest working towards being able to do 3 sets of 15. And we're always training both sides. If this test is unsuccessful, if you're unable to get the leg up and back behind you, then we want to regress that motion. Again, rolling forward lightly, core engaged, breathing happening, engaging that glute with the knees bent and heels in line in order to raise up and squeeze that back glute muscle. A lot of times we'll end up rotating here, trying to get all the way up, but that allows that lower back and mid back to work. So we're going to stay steady there and make it just a hip movement. You can always progress by adding a band, adding some external resistance, doing this in standing. There's a million variations there. If you'd like more support with that or any of these topics, go ahead and comment below with your questions. I can't wait to answer them. Next, we're going to work into your glute maximus. And the job of the glute maximus is hip extension. So what we want to do is lay on our tummy, bend the knee to 90 degrees. I suggest placing the foot down, engaging your glute, and driving straight up. Can you hold that? And if so, is that the thigh, the hamstring, the glute, or the lower back? If you can, wonderful. Again, begin on working towards 3 sets of 15. Some people who can do it but maybe have a lack of hip extension could benefit from having a pillow under the waist, and that's okay. If you're getting a cramp, and a lot of people cramp up right here, it might be in the hamstring. It might be right back here. And that's an indicator that we don't have full control of those glutes. So we can either go back to our back with our knees bent, or right here, can you squeeze your butt muscles without squeezing your thighs or lower back, without holding your breath? We want to be able to do that squeeze well while we breathe and relax, and make it simple. And as you do this and as you progress, try this in sitting, try this in standing, try this in different positions, maybe in side lying as you're just watching TV. And as you progress from being able to engage both glutes, progress then to engaging one glute at a time. Just right glute, just left glute. And before you know it, you'll be twerking. Just kidding. So, working towards being able to do 3 sets of 15 of that hip extension, one of the primary reasons that this is such a vital test is that if we don't have good glute strength and good glute control, we're never going to work into proper functional movement patterns, which many of them are hip hinging drills. Just like the deadlift that I was demonstrating earlier, we want to have that strength and we need to have that strength. And if the lower back doesn't cause us pain there with improper movement patterns, the knees will, because we're going to be lunging or leaning into the knees. Both of those situations I don't want for you. And for the thigh here, what we're going to do is, again, start with our core, stabilize here, draw belly button in and wide, and we're going to push the straight leg straight down without flexing back the toes, without making it a total body exercise. So just quad, just core as we breathe. And then can we lift up to about 30 or 40 degrees? And then we're back down. Nice and steady there. A minimum amount of time you should be able to do these 3 exercises is 3 sets of 8 to 12. Really want to be able to have a good amount of control before you burn out, before other things start happening. With that straight leg raise, a lot of people feel it up here in the front outside of the hip. That's the incorrect muscle. We want to be down here right on top of the knee and thigh. With the glutes, we want to be right in the center or right off to the side for the glute max and the glute medius, and being able to really control those muscles without something else taking over, like the lower back or the hamstring. So a squat should be feet shoulder width apart, weight through my whole foot, but I sit back into my hips and my heels, leading with my hips because now I trust my hips, and my torso and shin stay parallel because I have that mobility and strength and now control down, and I can beat gravity. If I need to get to and from the floor, say to get something down at a low shelf or to play with the kiddos, I want to take a big step back, heel off the ground there, and sit into my lunge position, right? As I get up from there, my thighs are working, my hips are working, my trunk is working. And as I go into my deadlift, again, that nice wide stance, hips lead the way, and my chest is going to come down. Maybe I'm picking up laundry or a case of water, something heavy. If I'm picking up something heavy, kid, laundry, water, whatever it may be, I'm going to intentionally draw my core in to stabilize that spine. I don't just expect this to work. I want to be intentional about this activation, and I hope you are too. So draw in and wide, sit into those hips, create that force by pushing out through the knees and hips to create activation in your glutes. Whole foot stays planted, and now my trunk can come back so I can create that pressure through the floor and have a good, strong lift. I hope that video was super helpful for you. If you have any questions or comments, go ahead and feel free to leave a comment for me below. I'd love to hear your thoughts and opinions and any questions I might have stirred up. And if you would like an entire plan laid out front to back of how to do your full assessment, mobility training, baseline strengthening, functional strengthening, and back to full life, all the way back to running, swimming, and beyond, go ahead and comment with Bye Bye Back Pain. I'd be happy to take you through a call and see if you're a good candidate for the Bye Bye Back Pain program, which lays out everything you need for a back pain-free life. Otherwise, thanks for watching. Have a great day. I'll see you guys on the next video.